We're always busy thinking about the next thing we're going to say, thinking about a diagnosis, thinking about, oh, I have to hurry up. I mean, those are some of the things that could be going through your mind. But you can't listen when you're thinking of other things.
Native people are comfortable with silence.
The way our healthcare system is set up today, it's sort of tricky. It's just, time constraints.
And we are not often given time, especially in clinics where we have to see patients in 15 minutes or 30 minutes.
You both come in with agendas for what you want to get done as a provider and what the patient would like to talk about, and the cultural aspect of it is another twist to it.
It takes patience is what it takes. Sometimes that means just not interrupting. Our training encourages us to ask questions and more questions, and I would just say, let the patient talk. And when they're done talking, say, is there anything else that you want to talk about?
And then when you do ask those questions, take the time for them to respond, because we're not going to respond, We're not going to have a quick answer all the time.
I know that with my grandmother and my great-grandmother, they always said they talk very slowly.
And that comes across in the non-native health professional or the non-native community sometimes as being either unassertive or low self-esteem.
People need to be open, and people have to want to learn about another culture.
Invest your time and actually learn about their culture, learn about their background, learn about their history within that tribe. And I think that will provide you tools that will better improve your quality of care to that person.
I think one of my first encounters as a young mother with the healthcare profession was pretty traumatic. I was having these stomach pains, and so I'd gone to the doctor and sent me back home and said the baby was stretching my uterus and gave me some morning sickness pills. And I thought I was at 21, just newly married and first time being pregnant, and I thought, morning sickness pills at 7 months, boy, that's odd, And well, I went home and took them, and I couldn't even hold those pills down. That's how sick I was getting. And by about, 4 or 5 o'clock in the morning, I had told my husband to go call the ambulance because I was sick. I knew something was wrong. I was in pain at that point, severe pain, and wasn't able to hold down any food or water. And so they flew me out to a bigger hospital, and I was actually having an appendicitis attack. So by the time I got to the hospital, it had ruptured, and they had threw me into emergency operation, and had called my mother and said, who do you want us to save, the baby or your daughter, And so it was pretty extreme, and that was one of my first healthcare encounters, with being misdiagnosed with a particular health problem, and trusting that doctor, but hearing what she was saying and thinking it wasn't right, and feeling that helplessness to really, knowing something was wrong with my body, but not being able to be heard.
There has to be a level of trust. I think that's basic. And the people that come to you to get care from you have to understand that, number one, you have investment within that community. That you are there to provide people care, and you're interested in these people.
As healthcare providers, our vision is very skewed. We see the sickest of the sick and a lot of the indigent and people who don't have homes. And so oftentimes we see the Native American patients who come are very, very ill, at end stage, kidney disease because of their diabetes, or very strong alcohol histories. And I would say just keep in mind that the population that we're seeing as providers is very, very skewed, and that there's a lot more to Native American people than our diabetes and our high blood pressure and our alcoholism. There's more to us than just that.
There are 500 plus tribes within the United States. With that many different tribal groups, it's important to recognize that there's similarities, but there's also differences.
If a person is a traditionalist, they may not be seeing just you as a provider, but to be healthy, they may be seeing a medicine man also. Our belief and our connection with our Creator defines who we are and what is healthy. Indian people that are in front of you really will not feel healthy or well unless that part of their lives is also in balance.
Traditional healing is being revitalized. You are going to see Native American people who are all the way across the spectrum as far as utilizing their traditional ways, or utilizing traditional medicine or Indian medicine, or taking part in ceremonies or rituals.
It's always been my first choice to do things the way that I was brought up believing, using herbs and teas and natural remedies rather than going to a doctor. When I grew up, doctors weren't readily available, and if you didn't have the money or a ride, you couldn't get to a doctor. So a lot of things were handled using these home remedies, and I grew up having that as a natural way of life. The healing ceremonies take care of a lot of the spiritual and mental depression that people have. I do have problems every time they hear me talk about medicine man or something. That way of thinking isn't validated in the healthcare profession at all.
Traditional healers have something that they can offer that you may not be able to offer.
One of my fellow medical students was taking care of an Indian gentleman, came in to see me. The student did after he'd had one encounter and was very angry. He said, this patient of mine has been seeing an Indian medicine man, and he waited too long. He's come in to see me now, Kathy, and this cancer he has metastasized. If he'd only come in to see me rather than going to this medicine man first. I was real disturbed about this and talked to the medicine man about it next time I went home. And the medicine man looked at me and said, he said, it's taken me this long to convince this person to come and see you. I'm glad that he has, because I think you can help him too. So there's always so many assumptions made, and we have to be very careful about that. Don't assume that everyone is Christian. Don't assume that we're all traditionalists.
When I was a med student, I asked the ER doctor if they could keep my appendix, because native belief is, at least in my tribe and culture, is that you need to go out of this world with what you came into it as, and if you don't, you're not whole. So, and that was the reason I requested it. And I can remember the expression on his face is that it was sort of surprise and it was sort of humorous. So the last thing I wanted to do was stop and explain to somebody why I wanted to keep my appendix. I didn't get my appendix. You know, what could I have done or what should I have done? And so if someone else came in at that point and, you know, had the same request, you know, whether it be Native American or Hmong or any other culture that has the same belief, you know, it may have helped sort of alleviate some of that, I don't know, I guess, you know, what you'd call it is that, you know, lack of communication or you know, just disrespect.
I often see people, children come in not with their parents, but with other family members. It could be a grown sister or a grown brother, or it could be an aunt or an uncle who brings that child in. And people will often misinterpret that as now the parents not being invested in their children and stuff, which is an absolute fallacy. It's not correct. They don't understand the context of an extended family.
My dad had a heart attack, and I remember when he was so sick in the intensive care unit, our family showed up. 30 to 40 people in that waiting room at any given time. We certainly sensed from the hospital staff that this is not something that they were comfortable dealing with. What is normal for us is when someone is sick, we show up. But our idea of family is not just mom, not just sisters and brothers, but our family was there, and our family was all of our extended family. Grandma, grandpa, aunts, and uncles. Whoever needed to be there was there. However, we can't assume that every Indian person that comes before us is traditional, because we're not. Many are, but there are also many Indian people that have embraced other religions.
People that expect, because we're Native American, we're going to act a certain way, or look a certain way, or talk a certain way, and that's just not true.
You cannot simply treat every Native person the same way.
As a Native person, I really had to learn how to ask questions. I had to learn how to talk to healthcare professionals so that they won't dismiss me. I have to have my voice loud enough for them to hear me. Otherwise, I wasn't getting noticed.
I am who I am, and I can sit down and tell you all about it, but a lot of people that I know can't. You know, that's the way that we were brought up.
Eye contact does not necessarily mean the same thing to an Indian person and to you. If an Indian person is perhaps not looking at you straight in the eye, that doesn't mean they aren't hearing a word that you're saying. Many times we're taught to give our ear and listen, and it's respectful to do that.
One of the things I do up front is sort of to try to talk to them about, you know, educate me, you know, and let them know that I can learn from you as well as you learning from me. So, and I think that, you know, if a provider ever has questions about anything, you know, from a cultural standpoint, ask the patient.
When you're going through the medications and they're telling you all their prescription medications, to then ask, are there any herbal medications or traditional practices that you practice? And just to make it a routine and a habit. Which do you prefer, Native American or American Indian? And to inquire about which tribe they come from, if they know, if they speak the language, if they carry on traditions. I think all those questions are important when you deal with an American Indian patient.
If you try to ask, and if you don't get an answer right away, or if you don't get the desired answer that you're looking for,